Hello, everyone. Welcome. We're just going to wait a minute or two so others can join. Hi, everyone. It's 3:01, so we can get started. Good afternoon. My name is Shreya Koirala. I'm the Public Health Program Coordinator for Hepatitis B Foundation. I'm thrilled to welcome everybody to today's webinar. It's a special one. We're launching our Community Education Outreach Toolkit, which is designed for Asian communities. So we're so glad to have all of you join us. Before we get started, a couple of housekeeping things. Since this is a webinar, all of the attendees are on mute, but we do have a question and answer button. You can see it on your screen. Please ask us any questions that you have throughout the webinar through the Q&A box. Once the presentations are over, we'll get to the questions and we'll answer them. There's also a chat button. Please feel free to introduce yourself, tell us your name, tell us where you're from and where you're joining us from. Also, this session is being recorded. We will share the recording and the presentation slides used for today's presentation with everybody in the next few weeks. For those of you who are joining us for the first time today, I'm just going to give a very brief introduction about Hep B United. Hep B United is our national coalition. It's dedicated to reducing the health disparities associated with hepatitis B. We do this by increasing awareness, increasing screening, encouraging people to get screened, get tested, link folks to care, and we do this for high risk, especially for high risk communities in the United States. Hep B United has more than 50 organizations and local coalitions, and we have partners in 40 cities and 27 states and DC. So today, the first thing I'm going to do is I'm going to take you through the Community Education Outreach Toolkit designed for the Asian community, what materials it has, and how it can be used. Then Dr. Nettie Johnson, who is the Executive Director for ACANA, also known as African Cultural Alliance of North America, is going to talk about African Toolkit. So Hepatitis B Foundation launched the African Toolkit a couple of years ago. Since then, it has been used by a lot of our partners, and Dr. Johnson is going to talk about how useful it has been for her organizations and for the communities that they serve. So let's get started. So the Community Education Outreach Toolkit designed for the Asian community is based on Train the Trainer model. So this is basically where we are training educators about hepatitis B, and they are in turn going out to their communities to train communities and families about hepatitis B and encouraging them to take care of themselves, get screened, get tested, and all that stuff. This outreach toolkit consists of a host of materials, which includes a downloadable presentation on hepatitis B for educators. It also includes a printable flip chart, which is intended for direct community education. It also has a lot of other fact sheets, which I'm going to take you through during my presentation. The idea behind creating this toolkit was to address need for increased awareness in the Asian community and increase people to take care of themselves, promote health behaviors regarding hepatitis B, encouraging people to get tested, get vaccinated, encourage conversations about hepatitis B, and get help and work towards improving their quality of life if they've been diagnosed with hepatitis B. The first material on our outreach toolkit is a downloadable presentation for educators. So this PowerPoint presentation is 51 pages long, and it's intended for community leaders and community educators so that they can get education about hepatitis B and also learn about how they can present this information to community members and families, and start a conversation about hepatitis B. So this presentation has a lot of information, some of which are, consists of basic information about hepatitis B. It talks about liver cancer. It talks about how hepatitis B can be transmitted, how it can be prevented. It also talks about where people can get screened, why it is important to get tested. It talks about treatment options. Furthermore, it also touches on what are some of the stigmas and misconceptions around hepatitis B that are present in the communities. It also and it gives tips on how we can move forward and tackle those misconceptions and tackle those stigmas and take care of ourselves. So the next couple of slides, I have included a couple of pages from the downloadable presentations, just so that everybody can have a preview and a little bit of a look on how it looks like. So as I said before, it has information on how hepatitis B can be transmitted. We've tried to use very simple language. We've used a lot of graphics, so it's easier for people to get information and learn about them. It consists information about perinatal transmission, and it consists information about how you can get Hep B and how you can also prevent it. So these are just a couple of slides from the 51-page downloadable presentation. Um, Once the educators are able to educate themselves and go through this presentation, we've created a very small survey. This survey is through SurveyMonkey, and we'll be asking community educators to take this survey and talk to us about how they felt the presentation was, if the presentation has enough information, and if we need to add additional resources to make it more user friendly, or if there's anything we need to change it. Our whole idea with creating this downloadable presentation was so community educators can have something they can refer to, that they can learn from, so that they can go out in their communities and do the work that they do, and they have this help and they can use this information to educate their communities. The second item on this toolkit is a printable flip charts. As its name suggests, these are printable. So these are materials that are going to be used by the community educators to go and educate their communities. We really hope that this flip chart helps the community educators in giving information about hepatitis B to their communities. We created it with thinking that it will help encourage discussion about hepatitis B between communities and families, and they have a space where they can talk about hepatitis B, ask questions they have about the disease to their community educators. We are also hoping that this helps people talk to their community educators about any concerns they might have about hepatitis B. And this flip chart also has also points people towards what resources they can get in their communities, where they can get help, where they can get meet their doctors, or where they can get tested, what kind of diet that they should be on, and how they can improve their quality of life. Just as I showed like a little preview of the downloadable presentation, I'm going to show you a little preview of what the flip chart looks like. So as I said, we created this flip chart hoping that it initiates a conversation, and we're really hoping that this flip chart is interactive. So communities feel that they have a space to ask their community educator questions and talk about hepatitis B. And we are also hoping that they get to learn about why hepatitis B can be common in their communities as well, and how they can tackle the disease, living with it, and how they can improve their quality of life. So this is what the flip chart looks like. So the downloadable presentation, which was intended for the community educators, and this printable flip charts have been translated to 4 different languages, apart from English, which is Vietnamese, Korean, Chinese, and Hindi. The downloadable presentation for educators has been translated in all these languages, and additionally, we also have an audio presentation available in all these languages, so that it's easier for people to take a look, understand, and learn more about hepatitis B and how they can help educate their communities. The flip chart has also been translated to all these languages. We at Hep B United actually already have printed these flip charts, and it's going to be shipped to Hep B United partnership in the next few weeks. Other materials that this toolkit includes are a couple of fact sheets. We have one where we're talking about where we are guiding the community educators on how they can use the flip chart for community education. And then we have another one where we're providing information about how to locate a doctor and how to find lower cost testing services. And how you can reach out to Hep B United partners, and talking about member states of Hep B United. So I'm actually going to show you where you can find these resources on the Hep B United website. So I'm going to stop sharing my screen for a minute and share the website. So this is the Hep B United website. We've actually went in and made a couple of updates, so it's more user-friendly and you can find things that you're looking for easily. In the Hep B United website, we have a new page that's called the resource repository, and we have a host of, we have a lot of resources about hepatitis B. You can find resources about hepatitis B by topic. Some of the topics you can see here, it's hepatitis B general information, hepatitis delta general information, screening and testing. The toolkits you can find if you press on the community education toolkits here. The fact sheets are right over here. And then there is a presentation. There's the hepatitis B training presentation for health workers. You can find the PDF version in English, Hindi, Korean, Mandarin, and Vietnamese. And then you can find the presentation video, which has audio in it in all these languages as well. And you can find the flip chart here as well, both the PDF version and the the PowerPoint version in all the languages that we have for it. In addition to that, we have the toolkit designed for the African community here as well, and it's also available in all these different languages, Arabic, French, Swahili, and in this resource repository, there's also a place where you can just press resources by languages and find resources in different languages. So hopefully this is an easy place for you to find resources. We've really worked hard on making it very user-friendly. We hope that you can use these resources for the work you do and for your organizations. And if there are resources that you have that you want us to present in this resource repository, you can do that easily by filling out a Google form, which you can find if you go to this website. The form looks like this. Once you add information about your resources, the Hep B United internal team will take a look at it, and once it's approved, we'll have it up on our website. So that's all about the Asian toolkit. Now I'm going to hand it over to Dr. Nettie Johnson, and she's going to talk about how she's used the toolkit design for the African communities in her work. Dr. Johnson, take it away, and I'm going to share my screen to show your slides. Give me a minute.
Hi, Shreya. Thank you very much for your presentation today. Thank you for having me. You can start now.
Yes, I'm just pulling up your slides.
Okay.
Here.
Hi, everyone. I'm Dr. Nettie Johnson. I work at the African Cultural Alliance of North America. I serve as the director of the health department at Akana.
Sorry,
Okay.
I'm pulling up your slides, just a little bit of a glitch.
Thank you.
One second. Here we go.
Hi, everyone. I'm Dr. Nettie Johnson again. I serve as the Executive Director of Health Department of the African Cultural Alliance of North America. I'm just happy to be here to share the work we do regarding hepatitis B community engagement. Next slide, please. Just to give you a little roundup of ACANA, ACANA was established more than 20 years ago, and we are located in Southwest Sheffield area in PA. We see mostly the African and the Caribbean immigrants and refugees. Lately, we have seen an influx of the African immigrants. We provide the holistic cultural and linguistic services to all who we see, irrespective of who you are and what you believe in. We offer a wide range of services, which include legal and immigration, and also the health and social services. We see an average of 7,500 people a year, and this number we are seeing is gradually increasing. As I said earlier, there is an influx of African immigrants right now. Next up, please. So the work that we do regarding the hepatitis B intervention in this area, we are so grateful to the Hep B Foundation for also all the work that we do. We have two goals here, which are to change the mindset of the migrants and refugees so that they can add Hep B treatment and screening in their way of life, as if you were dealing with a chronic disease like hypertension and stress and all the other issues and cancers also. So the next one is we also use it as a goal so that the African immigrants who are residing in this area have an access to culturally competent, language appropriate health education. So we do that through tabling events and community outreach and workshops, screening events, and connection to service as needed. Next slide, please. How we implement our work, we do, as I said a few minutes ago, we do meetings, which we term as monthly wellness meetings. They can be held on Zoom or also here at ACANA. Now with the dawn of the COVID-19, we are seeing that a lot of organizations are moving towards having meetings online. So we are also at ACANA are having these meetings, and we have an average attendance of 60 people who come on Zoom, and the number of people who come more frequently will be like 35 people. We also do tabling events in the community, and we do it mostly on Woodland Avenue, and that's an area which has all the stores in the greater Sheffield area. We do screening events too, and we work with the Hep B Foundation and the Sheffield Department of Health. We also do evaluation where we have meetings. We invite the community members in, and they tell us how they enjoyed the meetings, and that way we are able to measure a change in knowledge and also a change in behavior, and see how many people are receptive to do the screenings of vaccines as it's relating to 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 hepatitis B. We also do referrals and monitoring. We want to make sure that people who receive the information, they know how to explain it into whoever in their homes or family members. And just so to see if you have a screening results and that needs more treatment or counseling regarding that, we also do that. Next slide, please. The activity of the year, March 2023 to February 2024, we had these numbers of workshops as listed on the screen. We had sibling events, and we see an average of 30 people at a sibling event. And these events are held at places of worship and community events, at schools, at Akana Hall. We do it anywhere that there is an event, and we also do it at recs, shelter places, and parks, also in the neighborhoods. On a hepatitis screening, we had 2 screening events, and they were held last year in March, and another one held in August of 2023. And these screening events saw that 32 people were screened at those events, and 12 received the vaccine. It's highly stigmatizing right now. Not a lot of people really know much about hepatitis B, maybe because of its insidious nature. So they do not understand a lot about hepatitis B. So we are here to do more awareness and engagement. Next slide, please. As you can see, we have a few flyers up here where we do the community engagement events. We do the workshops and also screening events. And we do a lot of work with the Hepatitis B Foundation and the Department of Health here in PA. Next slide, please. The Community Education Outreach Toolkit, and we are looking more towards the African Outreach Toolkit. We started using it in the second half of last year, and we found it to be very reliable. And these are the responses here of the community. They saw it as very, very favorable, and the overall regards of it was that it was very good, and they learned a lot from it. And also they like the colors and pictures and having a representation too on the use of these materials. It was very appealing and culturally relevant, and they saw it as very needed at this time. And even our team at Akana also have this same view. Next slide, please. The health department team here at Akana and the community members also saw that even though the language was very simple, that anyone who had like a 3rd grade knowledge or more was able to read it and read it clearly. But they also saw that there was enough information that people in the community were able to understand understand. They had another thing in the toolkit that mentioned like on the transmission, how it is transmitted. And there are so many ways on how how hepatitis B is transmitted. And but what we asked them also was if the inclusion of intimacy was relevant and it was said in the right manner. And most of the community members also said that it was appropriate. Next slide, please. These were the topics that we found useful in the toolkit, and we have started using it. It's easy to print out, very captivating, and we were able to hand them out at the sibling events in the community. We can highlight a few here. Will be number one, how is it transmitted, all the information on the prevalence of hepatitis B and where it is seen mostly in the world and how anyone can have it. And then we also review the myths and the misconceptions and questions to ask your healthcare provider. And also there was some information on liver cancer also. And what we looked at most was easily accessible was this social media ones that you could just easily just download and place on your social media page. So that was interesting to know that also. So and then another one that the community members liked also was it takeaway cards where you could just easily hand it out to whoever talk about something that had the least similarity to hepatitis B so that people will read about it and see how it is transmitted and how it is treated and all of the above. Next slide, please. So how did we implement this toolkit? We went and we had all these, and it's easy to download. You can make a lot of copies of it. We use it during sibling events, during health events, large and community events where we will have in the park, at recreation center, at a kind of hall also. And also we have an we have an on-site clinic here at Akana where we have a nurse here who sees patients twice a week on Tuesdays and Wednesdays, and it's so interesting. And then also we use it also during our meetings. We do monthly wellness meetings. So we include hepatitis B like into these meetings, the awareness. And then also lastly, we use this toolkit during our regular programming at Akana. So that means anyone who comes in Akana, we just hand you the flyer. We can explain more about it if you need more information. Next slide, please. So these are the best practices that we use at Akana, and we were able to achieve a lot. We obtained the community members' knowledge and input on these materials so that we can know that they are able to use it, they are receptive to using it. And in this way, we will do like listening meetings, or whenever we had a workshop, we will incorporate it into it also and ask them if they had any questions about it. And also during we would hand these out right before a hepatitis B screening event in a community. And then we will make sure that our team had received training on the toolkit, because it will be a little bit too much that, that if you, a team member, had not had training on the toolkit. So we would train all of our team members. During the workshops and event, I kind of health navigators who are very trusted members in the community, who share the same language and culture, and sometimes they live experience also. So they will serve as a center, and they will translate these messages into languages and dialects as listed out here: Mandingo, Tree, Fulani, and French. Also, we will include hepatitis B screening and prevention at these health events and fairs, because having just one event on just hepatitis B, sometimes people do not really understand it, and they are a little reluctant, and a community that we serve needs a lot more to explain. And like any community that is newly an immigrant and community, it takes a while to remove all the layers of living in America. So we would do that, right? We would add it into a cancer screening event, a mammogram screening event, where we will just add hepatitis as screening also. Then also we establish a clear path where people will obtain their screening results. Because if you do a lot of screenings in a community, and people, even though they are mailed out into them, but a lot of them would like to have the screening results here through the Akana's nurse at the clinic. So it is mailed here, and we call them, and then they come over and open the letters. And if they have any questions and to ask, our nurse is available to explain, or all the members of our health team can also explain. And if we do not know any information, we send out a referral to the hepatitis B foundation staff. Also, it is worth mentioning that we need to do regular workshops, and it must be promoted to increase awareness, especially among the African immigrants coming to a culture where, due to conflicts and other issues and layers, most people only will seek healthcare at an acute level. So it brings into mind that we have to highlight the preventive arm of healthcare. So stressing this during our awareness meetings and workshop has really learned a whole lot. Next slide, please. And wanted to close is that we are at Akana, we are learning more and more every day. We are seeing more, but we tap on the knowledge of the community that we work with, which are the African and Caribbean immigrants, and they have a lot and to say also. So we do listening meetings, not just on hepatitis B, but on COVID-19, on cancer prevention, on research, because we are moving now where we will do research on hepatitis B, awareness and knowledge and change in behavior. And I must mention that all these screenings that we had in the past, there was a small number of people who actually tested positive for hepatitis B. So that also tell the community that, hey, I don't actually need to be screened, and we don't want to say it in that manner. We want to increase screening and look at it the other way. It's okay to be screened. Know your know your status, and if you need treatment or care or counseling, we are available to help you. Next slide, please. We're just at the end of our slide right now. We just added these 2 slides on the hepatitis B toolkit that are very, very captivating. You do not have to be afraid to get tested. I know a lot of people don't like needles and blood draws and things like that. And then also, we want to also highlight that hepatitis B is manageable, and people with the virus, they can live long, healthy lives. So with that being said, we want to thank the Hep B United, the Hep B Foundation, and the Philadelphia Department of Health for always showing up when we ask them to come and see the people in our community. And I also thank you all for listening. And if you have any questions, I'm available.
Thank you so much, Dr. Johnson. We're so glad that the toolkit was helpful and people found it culturally relevant, and the language used was simple and everything. That was our whole intention with creating the toolkit. Based on the feedback from the African toolkit is why we started designing the toolkit for Asian communities. We've been working on it for the past year, and we have partners who mostly serve Asian communities. We had them come in, take a look at the toolkit materials and give us feedback. So based on that, we've made changes to the toolkit. So we are really hoping that the Asian toolkit is also a useful resource for all of you, and you find culturally relevant, and you find it easy to use. When you do use the toolkit, please leave us a feedback so we can learn from it, we can improve the materials we create, and we can continue being place where you can find resources for the work you're doing. Dr. Johnson and I'm happy to take any questions you might have about the toolkit or about the resource repository. Please feel free to drop your questions on the chat button or the Q&A box. I see a lot of you have been asking if you'll get the slide deck. Yes, you will. I will share the recording of this webinar, and I'll share the slide deck with all of you. Again, the toolkits, both the African toolkit and the Asian toolkit, are available on Hep B United's website under resource repository, so you can find them there. If you have questions about it, or if you have questions about how you can upload your resources to the resource repository, please let me or Frank know. I'm just going to drop my email address and Frank's email address to the chat here. And we'll be happy to take a look and upload your resources to the resource repository too. If you don't have any questions, I'm happy to give you almost 20 minutes back to your day. Thank you so much for joining us today. We really hope that you found this webinar useful, and we hope that you can use both these toolkits for your I see a question in the chat. Can the downloadable presentation be modified to meet specific community needs? So for the downloadable presentation for community educators, the one that has been uploaded to the website is in PDF format. But please feel free to reach out to me, and I can share a PowerPoint version with you, and you can add a couple of slides if to meet the needs of your community, or where you're going with that, what you want to do with it. I hope that answers your questions. Again, thank you so much for joining, and I hope that these resources are helpful for you and your community. And I have another question in the chat. Sorry. I'll just let you go after this. I answer this question, I promise. So we have a question and the question is, on one slide, there's written that happy can be transmitted through close contact, and it has a picture of two hands holding each other. So if you actually go through the slides and read the language there, it says hepatitis B can be transmitted through sexual fluids during sexual contact. But as we had the slides get reviewed by some of our partners, we thought it would be necessary to not have the word sex in there, so we wrote it as intimate contact, and we added what we thought would be an appropriate picture. But if you actually go in there and read the language, it says that hepatitis B can be transmitted through sexual contact. And I hope that answers your question.
Yeah, and
thank you all again.
I just want to make just one comment. Yeah, even adding changing that language would really help the community members, especially the Africans who don't just talk about that issue everywhere. It's very close knit, and having it like an intimate, it was good. Yeah, so I think the toolkit, it resonates with all communities, and it's easy to use. It's very colorful and it's captivating, and I think it's a great job. It's a great resource tool. We use it all the time now.
Thank you, Dr. Johnson. Thank you, everybody, for joining, and have a great rest of your day. Bye.
Bye.